one of the last things you mentioned were basic human and safety needs and the access to transportation. It goes into to so many things. It makes me think how life expectancy in the United States has been declining over the last few years, and now we rank last in the developed world for life expectancy. It's a country that espouses life, liberty, and the pursuit of happiness, and we get the first one wrong. And we're right here in the middle of the Olympics. Looks like we're going to win the medal total for the world because we value the Olympics to the point where we invest heavily in winning. Yet life, somehow we're okay with that coming in last in the developed world. That doesn't really make a lot of sense to me. And when you start looking at this in a global sense across the country, it isn't in every community. We have pockets of communities where life expectancy can be as much as 3 decades shorter. And we talk about the American dream, and the original definition of the American dream was that everyone has equal opportunity regardless of their circumstance at birth. And when you look at zip code, and people born in certain situations have a 3-decade shorter life, we can't say that the American dream is alive and well. I'm mentioning this in the context of our conversation because they're directly related. One of the drivers of the decline in life expectancy is overdose deaths, is suicide deaths. But underlying that is the sense of chronic suffering that leads into so many other early deaths, from cancer to diabetes, heart disease, strokes. The same factors that lead to people overdosing and dying or committing suicide and dying also leads to an increase in cardiometabolic diseases and cancer early deaths in general. Again, this is not a moral failing, it's a disease. Just like cancer is a disease, just like diabetes is a disease, heart disease is a disease, substance use disorder is a disease. These diseases are coming out of chronic suffering that is allowed to continue in our communities, related to what the Surgeon General defined in a report that they published in 2019, thereabouts, as vital community factors. Sometimes we also talk about them as social determinants of health. These vital community factors are humane housing, transportation, having your basic human and safety needs met, a sense of community and belonging, lifelong learning. These things are so inherent to what it is to be human. If they're lacking, people die. They die from cancer. They die from diabetes. They die from loneliness. They also die from overdoses related to substance use disorder. So as a physician, I like to take a step back and not say, this is unique to people living with substance use disorder and dying of substance use disorder. This is a community harm. And how do we reduce the harm that's occurring in our community in general? We do exactly what John said. We start connecting to people on a human level.